Hi guys, my name is Thurkhesan. So today I'll present about positron emission tomography (PET). So first of all, the history of PET medical imaging. So the first large-scale use of a human positron imaging device was developed by physicist Gordon Browner and neurosurgeon William Sweet at the Massachusetts General Hospital in the 1950s. So the types of PET scans, there are three types of PET scans. The first one is PET F18 FDG scan, which is it is used for glucose, can sometimes done immediately after the PET scan to determine if heart muscles has permanent damage. The next is cardiac PET scan. A cardiac PET or SPECT scan is a type of cardiac molecular imaging that involves the injection of a radioactive label or tracer to circulate to the heart. The patient then undergoes a scan of the heart that detects the signal of the tracer and produces a 3D image. The last type is PET or CT scan. The PET or CT scan is a hybrid of imaging technology that combines PET and CT scans, allowing for a more accurate diagnosis. Next is definition and what is PET. So basically, positron emission tomography is a type of nuclear medicine procedure that measures metabolic activity of the cells of body tissues. So PET is actually a combination of nuclear medicine and biochemical analysis, used mostly in patients with brain or heart conditions and cancer. PET also helps to visualize the biochemical changes taking place in the body, such as the metabolism of the heart muscle. Next, I'll explain how does a PET work. So, PET works by using a scanning device emitted by a radionuclide in the organ or tissue being examined. The radionuclide used in PET scans are made by attaching a radioactive atom to chemical substances that are used naturally by the particular organ or tissue during its metabolism process. For example, in PET scans of the brain, a radioactive atom is applied to glucose to create a radionuclide clot called fluorodeoglucose, which is FDG, because the brain uses glucose for its metabolism. And FDG also is widely used in PET scanning. Next, I'll explain how to use a PET machine. So basically, the radionuclide is administered into a vein through an intravenous line. Next, the PET scanner slowly moves over the part of the body being examined. Then the positrons are emitted by the breakdown of the radionuclide. So gamma rays called annihilation photons are created when the positrons collide with electrons near the decay event. The scanner then detects the annihilation photons, which arrive the detectors in coincidence at under 80 degrees apart from one another. Computer analyzes those gamma rays and uses the information to create an image map of the organ or tissue being studied. And the amount of the radionuclide collected in the tissue affects how brightly the tissue appears on the image and indicates the level of organ or tissue function. Next, I'll explain why PET is performed. So, in general, PET scans may be used to evaluate organs and tissues for the presence of the disease or other conditions. PET may also be used to evaluate the function of organs such as the heart or brain. The common cause of PET is the detection of the cancer and the evaluation of cancer treatment. So basically, it is to diagnose dementias, Parkinson's disease, uh, Huntington's disease, epilepsy, which is a brain disorder involving recurrent seizures, stroke, to locate the specific surgical site prior to surgical procedures of the brain, to evaluate the brain after trauma, to detect hematome, bleeding, to detect the spread of cancer to the other parts of the body from the original cancer site, to evaluate the effectiveness of cancer treatment, to evaluate the perfusion to the myocardium as in aid in the determining the usefulness of the therapeutic procedure to improve blood flow to the myocardium. Next is to further identify lung lesions or masses detected on the chest X-ray. Next, to assist in the management and treatment of lung cancer by staging lesions and following the progress of lesions of the treatment. So the last one is to detect or recurrence of tumors earlier than with the other diagnostic modalities. Next, I'll explain about the advantages of PET scans. The first advantage is the double the diagnostic clarity. So clearly, the fact that a PET scan show different things that when combined, patients have twice the diagnostic benefits. Alone, a PET scan will show areas of increased activity within the body, while a CT scan alone produces detailed images of tissue and organs inside the body. So together, the scans allow our doctor to see exactly where the issues are and what may be contributing to it. It can help differentiate between a cancerous and non-cancerous mass also in the body. The next advantage is it is a relatively painless procedure that measures both anatomy and metabolic function within the patient's body, as images are captured in a single scan. The third advantages are the actual scan only takes about half an hour to complete. The fourth and the last advantage is it is easy and not disruptive. Aside from the initial injection of the radioactive material, the exam is non-invasive and requires no recovery or downtime afterward. Patients may immediately assume normal activities after a PET scan. The limitation of PET scans are pregnant women should not undergo PET scan because the radioactive traces used may be dangerous to the baby, while the amount of radiation received is negligible and isn't any more dangerous to patients than the exposure they receive from a low dose X-ray. Pregnant women should avoid any exposure to radiation while pregnant or breastfeeding. The next limitation is diabetics may undergo a PG scan but with certain precautions because the radioactive material is combined with glucose and then injected into a patient. This can be a concern for some diabetic patients. Before having a PET or CT scan, a diabetic patient's blood sugar level will be evaluated and a glucose serum blood test may be administered. This can significantly increase the time required to complete the testing. Next is problem and its solutions. The first problem is increased count rate performance, light output, and usability. So the solution for it is faster and cheaper scintillators. So its application is to cost reduction in clinical scanners, higher image quality in preclinical systems. The next problem is facilitates the manufacture of crystal arrays, reduces cost, increase sensitivity by avoiding the need for reflectors in between crystals. The solution is subcircle laser engraving of scintillators. So the application is to clinical and preclinical, but more relevant for preclinical use due to the higher complexity of the crystal matrices. The next problem is it reduces the cost of detectors, enables magnetic compatibility for combined PET-MR imaging. So the solution for it is solid-state photodetectors. Its application is used in combined PET-MR scans. They reduce the cost of the PET gantry. New application may be based on more compact detectors. So the purchase consideration for PET imaging is there are quite a few things to consider before you choose your PET scanner. So the first one is what kind of studies will you be performing. The next is what kind of cooling system is best for your needs. And the third one is do your physician have a brand preference. The fourth consideration is what's your budget. Depending on your budget, you may find that buying a used or refurbished scanner delivers the performance you need at a lesser price. So for conclusion, PET is a type of nuclear medicine procedure that measures metabolic activity of cells or body tissues. PET is actually a combination of nuclear medicine and biochemical analysis used mostly in patients with brain or heart condition and cancer. So PET helps to visualize the biochemical changes taking place in the body, such as metabolism of the heart muscle. The PET differs from other nuclear medicine examination in that PET detects metabolism within body tissues, whereas other types of nuclear medicine examination detect the amount of radioactive substance collected in the body tissue in a certain location to examine the tissue's function. So these are my reflection. So what I learned is types. What we learned is types of imaging technique, application of PET medical imaging, operation of PET machine, application and diagnosis of use of PET imaging, advantages and limitations, purchase consideration of a PET machine. So these are the references I used. So before we end, let's watch a simple video about the PET imaging.
A PET scan creates 3D images of the body. It does this by using radioactive tracers, which are usually administered to a patient through intravenous injection. The tracers are made up of carrier molecules that are tightly bonded to a radioactive atom called an isotope. The carrier molecule can interact with or bind to specific proteins or sugars in the body. The carrier molecule that will be used depends on what the doctor is looking for. If she suspects cancer or is monitoring a known cancer's growth, she may use FDG, a modified form of glucose, which gets absorbed by tissues. When tissues absorb a lot of glucose, it may indicate a cancerous tumor. The radiation from the tracers poses little danger to the patient since they quickly pass out of the body. The isotope produces small particles called positrons, which interact with surrounding electrons. This interaction results in the complete annihilation of both particles, releasing two photons that speed off in opposite directions. The detectors in the PET scanner measure these photons and use this information to create an image of the distribution of FDG in the body.
Thank you, everyone.